It's funny. You see a dog maybe get stung by a bee, and okay, they yelp, maybe swell up a bit.
Mm-hmm.
Or, someone, maybe a friend, whose whole world changes if they accidentally eat a peanut. It's just wild how these tiny encounters can cause such huge reactions in us and in our pets, too.
Oh, absolutely. And that's really what we're drilling down on today. This isn't your standard seasonal allergy chat.
Right.
We're taking a proper deep dive into anaphylaxis, specifically in dogs and cats, using info from, well, a detailed medical text.
Okay.
So not just scratching the surface. We want to get into the nuts and bolts of these really, really serious reactions.
Exactly. No random web searches here. Our mission really is to pull out the core stuff so you can understand what anaphylaxis is, why it happens, and crucially, what you absolutely need to know. Think of it as getting you the essential info on this, well, potentially life-threatening thing for your pets, but without you needing a medical degree to follow along.
Yeah, trying to cut through the jargon.
So, to kick things off,
Yeah.
what exactly are we talking about when we say anaphylaxis in dogs and cats?
Okay, so at its core, anaphylaxis is a really fast, really intense reaction. It's what's called a type I hypersensitivity reaction.
Type I, okay.
And the key thing here is it involves a specific trigger, an antigen, maybe something in venom or food,
Right.
And it happens when this antigen gets introduced, often very quickly, into a pet that's already made specific antibodies against it. We're talking about IgE antibodies here.
IgE.
Yeah.
So the body's seen this thing before, and it's sort of set up these defenses almost like a tripwire.
That's a great way to put it. A tripwire, exactly. So when that same antigen shows up again, it bumps into these mast cells. Think of them as tiny alarm bells throughout the body.
Okay.
And these mast cells are already coated, armed, really, with those IgE antibodies. That connection triggers a super fast chain reaction. The mast cells basically dump out a whole cocktail of potent chemical messengers.
Wow.
Now, it's probably helpful to know we see both localized reactions, we often call that OFI, like skin allergies, itching.
Mm-hmm. The more common stuff.
Yeah. And then there are systemic reactions. That's the whole body event, anaphylactic shock. And given how serious that is, our focus today is definitely on the systemic side.
Right. Systemic.
Yeah.
Affects the whole body. That sounds much scarier. Now, you mentioned, or the source did, anaphylactoid reactions, but we're not covering those today. What's the difference?
Good question. Yeah. It's an important point for clarity. Anaphylactoid reactions look very similar on the outside. The signs can be almost identical.
Okay.
But the mechanism inside is different. They don't involve those IgE antibodies we just talked about. They get triggered by other immune pathways. So just to keep things focused, we're sticking to that classic IgE-driven anaphylaxis today.
Got it. IgE pathway. That's our focus. Okay, so let's dig into the why then. The
Yeah.
pathophysiology. What is actually going on inside the pet's body?
Right. Think of it happening in two main stages. First is sensitization. Second is the reaction itself.
Sensitization.
Yeah. So the very first time your pet encounters that specific antigen, let's stick with the bee sting example,
Okay.
their immune system might go, what's this? And start producing those IgE antibodies. These IgEs then latch onto the surface of those mast cells, those alarm bells we mentioned. Now, usually this first time, nothing dramatic happens. You might not even notice. But the pet is now sensitized. Their body is primed. The tripwire is set, basically.
So the body's learned to recognize it and has set up this rapid response system for next time.
Exactly. And here's where it gets, well, pretty dramatic. On the next exposure to that same antigen, those antigen molecules find the IgE antibodies sitting on the mast cells.
Right.
And if one antigen molecule connects or cross-links with two or more IgE antibodies on that same mast cell, it's like flipping a big red switch.
Okay.
That cross-linking is the trigger. It tells the mast cell, release everything now, and that's called degranulation.
Degranulation.
Right.
Sounds messy. Like something bursting open, what's actually getting released.
Yeah, you can picture the mast cells like tiny water balloons packed with really strong chemicals. Degranulation is them bursting.
Okay.
The big players, according to the source material, include histamine. That's one people often know from, like human allergies.
Right. Antihistamine.
Exactly. Then there's a eosinophilic chemotactic factor and a whole group called arachidonic acid metabolites, fancy name. But it includes things like prostaglandins, leukotrienes, thromboxanes. Basically more powerful inflammatory stuff.
Wow.
Plus, you get platelet activating factor and enzymes called proteases. It's quite a chemical storm.
That is a lot of stuff being dumped into the system all at once. And what do all these chemicals, what do they do to the body?
Well, together they unleash chaos. basically, a cascade of effects. Think increased vascular permeability. The blood vessel walls get leaky.
Leaky blood vessels.
Yeah, and the key is how fast this happens. Suddenly, the circulatory system can't hold on to fluid properly, blood pressure can plummet, and you can get swelling.
Okay, that sounds bad.
Very. These chemicals also cause smooth muscles to contract. That can squeeze airways, making breathing hard, and mess with the gut too. Plus, they call in inflammatory cells, which adds to the inflammation, and unfortunately, all this can actually damage tissues.
So it's this huge, fast, body-wide inflammatory mess
Yeah.
causing all the problems. And I guess the intensity must vary a lot.
Oh, absolutely. The signs you actually see depend on, well, how the trigger got in, how much of the trigger there was, and just how strong that pet's IgE response is.
Right.
Which explains why, one dog gets a bee sting and has a little swelling, another has a life-threatening collapse. It's the level of that preset sensitivity.
Okay, that makes sense. So we know what it is now, down at the cell level, and why it happens.
Yeah.
Let's talk about what you, as a pet owner, might actually see. Which parts of the body get hit hardest?
The source points to several key systems. The gastrointestinal tract first. You might see lots of drooling, vomiting, diarrhea.
Okay, common signs, but sudden.
Sudden, exactly. And here's something interesting. Specifically for dogs, the liver and bile ducts the hepatobiliary system.
The liver? Really?
Yeah. In dogs, the system can get hit hard. You get high blood pressure in the liver's vessels, and those vessels constrict. It's a very dog-specific thing in severe anaphylaxis.
Wow, okay. That's definitely news to me. Good for dog owners to know. What about cats? Different.
Often, yes. In cats, the respiratory system frequently takes the brunt. So you look for dyspnea, that's difficulty breathing, labored breathing, and cyanosis. That's where their gums or tongue might look bluish because they're not getting enough oxygen. That's a huge red flag in a cat.
Both of those sound absolutely terrifying to witness. Are there signs that are maybe more visible on the outside?
Yes, definitely. The skin is a big one. In both dogs and cats, you might see pruritus, that just means intense itching.
Okay.
Urticaria, which is hives, those raised, itchy bumps. And edema, which is swelling. Could be facial swelling, swelling at an injection site, sometimes more widespread. Often these skin signs are the first things an owner notices.
So, sudden vomiting, hives everywhere on your dog, or your cat gasping for breath and drooling.
Yeah.
Yeah, those definitely sound like get to the vet now signs. It's just anaphylaxis goes as common.
Well, those localized allergic reactions, like the itchy skin from environmental allergies, especially in dogs, pretty common, yeah. But the really severe systemic anaphylactic shock we're focused on, thankfully that's considered rare overall, but it can happen in both dogs and cats. They're both susceptible.
Okay, rare, but possible. Are certain breeds more likely to get it?
That's interesting. The text mentions quite a few dog breeds known to be predisposed to aatectopy, those localized skin allergies.
Right.
But, and this is a key difference, it specifically notes no cat breeds are documented with that same predisposition for aatepy.
Huh. No specific cat breeds for skin allergies.
Not according to this source, no. And when it comes to systemic anaphylaxis itself, the text doesn't really highlight specific breed risks in either dogs or cats, in the same way it does for atophy in dogs.
That's really interesting about the cats. Okay, what about age? Does it happen more in puppies, kittens, older pets?
Well, for dogs developing those initial sensitivities, the onset of atophy, which kind of sets the stage, is usually between, say, 3 months and maybe several years old. Most seem to show up between 1 and 3 years.
Okay, young adults mostly.
Yeah. In cats, it seems to be a bit later, generally, maybe starting around 6 months up to 2 years old, typically. So it gives you a rough idea of when sensitivities might first appear.
And any difference between males and females?
Yes, another little difference. For atophy, the localized stuff, it seems to be more common in female dogs.
Okay.
But in cats, no sex predilection mentioned. Affects males and females pretty equally.
Fascinating. These dog versus cat details are really useful. Okay, so let's picture it. An owner thinks, oh no, something's really wrong. What are the absolute crunch time signs they need to look for?
Yeah, the critical thing is remembering the first signs can really vary depending on how they were exposed.
Right.
But the source really stresses that the end stage of a severe reaction is shock.
Shock.
And it even points out the idea of a shock organ, the main system that gets overwhelmed. In dogs, as we mentioned, that's often the liver.
Right, the liver thing, yeah.
Yeah. In cats, it tends to be the respiratory system and the GI tract.
Okay.
And crucially, something that starts looking localized, like just swelling where they got a shot, that can blow up into a systemic crisis really, really fast.
So don't assume it'll stay small.
Yeah, got it.
What specific things might someone see at home that should make alarm bells ring loud and clear?
Okay, for dog owners, sudden, intense itching, hives popping up, vomiting, maybe suddenly defecating or urinating inappropriately, those are serious flags.
Right.
For cat owners, be super vigilant for intense itching, especially around the head and face, any difficulty breathing, sudden excessive drooling or vomiting. Any of those means immediate vet trip, no waiting.
Okay. And what would the vet be looking for when they examine the pet?
Well, they might see that localized swelling, maybe around a bite or injection site.
Mm-hmm.
In some dogs, they might actually feel an enlarged liver hepatomegaly. And interestingly, right at the start, the pet might seem really agitated, like hyper.
Hyperactive?
Yeah, but then that can switch incredibly quickly to them being lethargic, depressed, and then collapsing. That rapid change is a really bad sign.
Wow. That fast change from hyper to collapse
Mm-hmm.
sounds terrifyingly quick. Okay, what causes this? What are the triggers we should be aware of?
Well, the text is pretty clear. Almost anything could potentially be the trigger, the allergen.
Anything. Oh, great.
Yeah, I know. But some common culprits that get mentioned frequently are things like venoms, bee stings, wasp stings, snake bites,
Okay.
blood products if they have a transfusion, vaccines, definitely, certain foods, and various drugs or medications.
So a pretty wide range. Is there anything that makes a pet more likely to react like this? Risk factors.
Yes. The single biggest risk factor highlighted is previous exposure to that exact same allergen.
Ah, back to the sensitization.
Exactly. That first encounter primes the pump. The immune system learns to recognize it and prepares that massive IgE response. So the next time it sees it, even if it seems like a harmless little exposure, boom, the reaction can be way out of proportion.
That makes so much sense. The body's learned its enemy and just goes completely overboard the next time.
Okay, so diagnosis and treatment. What are the key takeaways for owners here? Remembering this isn't DIY advice, of course.
Absolutely not DIY. Diagnosis really hinges on the history. What happened just before the signs started? What did the owner see? How fast did it come on?
Right.
And then the clinical signs the vet observes. It's important for people to understand, because this happens so fast, there aren't really standard blood tests you can run during the crisis to say, yep, this is definitely anaphylaxis susceptibility.
So it's more about recognizing the pattern and the speed. What about those allergy tests people get for their pets sometimes? Yeah, things like intradermal skin testing, where they inject tiny amounts of allergens under the skin, or blood tests like the RAST test.
Mm-hmm.
Those can be useful later on, maybe to try and figure out what the pet is allergic to help prevent future reactions. But they're not really for diagnosing the emergency situation itself while it's happening.
Okay, so they're more for future prevention. Got it.
Mm-hmm.
When a pet is having that severe reaction, what's the immediate game plan at the vet clinic?
It is absolutely a full-blown medical emergency. Requires immediate hospitalization, no question.
Yep.
The main goals are, 1, keep the airway open so they can breathe.
Mm-hmm.
2, stop the circulation from collapsing, counteract that leaky vessel, low blood pressure thing. And 3, just get everything back to normal function as fast as possible. This almost always involves getting IV fluids into them fast.
IV fluids, okay. And specific drugs.
Yes, several key ones. Epinephrine, that's adrenaline. Usually injected, it's the #1 drug for treating shock.
Right, like an EpiPen for people.
Kind of, yeah. Then corticosteroids, like prednisone or dexamethasone, to fight that massive inflammation.
Okay.
If the heart rate is dangerously slow, they might use atropine to speed it up and help blood pressure. And if breathing is really bad because the airways are squeezed shut, a drug called aminophylline can help open them up.
Wow, sounds like a very intense intervention, all needing careful vet supervision.
Mm.
What if it's just a milder, localized thing, like just some hives?
Yeah, for very mild, clearly localized reactions, maybe just some hives, sometimes an over-the-counter antihistamine like Benadryl, diphenhydramine, or maybe the vet prescribes some oral steroids like prednisolone. In super specific, rare situations, a vet might even show an owner how to give a tiny local epinephrine injection if it's, say, always the same spot reacting mildly.
Okay.
But even what looks like a minor local reaction can suddenly explode into systemic shock super fast.
Right, we keep coming back to that speed.
Exactly. So any doubt, any sign it might be getting worse, vomiting, breathing changes, weakness, you go straight to the vet. Better safe than sorry, always.
Absolutely vital point. Don't wait and see if it gets worse.
Yeah.
Okay, what about after the crisis? What's the outlook? Prevention. Prognosis.
Well, prevention ideally is figuring out what caused it and avoiding it completely.
Easier said than done sometimes.
Oh, definitely. Might mean strict diet changes, keeping them away from areas with bees, being super careful about future meds or vaccines if one of those was the trigger.
Right.
Prognosis-wise, for those localized reactions, if they're caught and treated quickly, generally good. The pet usually recovers well.
Okay, that's reassuring.
But if the animal is already in full-blown shock by the time they get to the vet, the prognosis becomes much more guarded, can even be poor.
Wow.
It just hammers home how critical early recognition and speed to treatment really are. Time is absolutely of the essence.
Okay, so act fast, act fast, act fast. If there's one single thing you want every pet owner listening to take away from this, what would it be?
It's really understanding the unpredictable nature of it all and needing to be aware that if your pet has an allergy, it could potentially lead to this kind of catastrophic reaction that needs immediate vet help. Just because they only had mild hives last time doesn't mean the next time won't be much, much worse, even potentially fatal. That previous exposure is key.
Okay, so quick recap. Anaphylaxis, severe, super fast allergic reaction, dogs and cats, needs immediate vet care. Look for those sudden warning signs. Hives, vomiting, breathing trouble. And remember, prior exposure is a major risk factor. Getting help fast makes a huge difference.
That sums it up perfectly. And honestly, when you stop and think about how many everyday things, foods, plants, insects, meds could potentially trigger this kind of massive, dangerous overreaction, knowing this stuff isn't just, interesting trivia, it could literally save your pet's life.
It really does make you think, doesn't it? Considering all those potential triggers out there, maybe it prompts the question, what steps can you proactively take just to be more aware of your own pet sensitivities, their potential risks? It just highlights how incredibly complex and sometimes, bafflingly overreactive the immune system can be.